Okay, so our presentation is on mental health and nursing, and the people in our group is Landry, which is me, Owen, Madeline, Danielle, and Sammy. So, what is mental health? As defined by the World Health Organization, no date, mental health is a state of mental well being that enables people to cope with their stresses of life, realize their abilities, learn and work well, and contribute to their community. So, how is this relevant to nursing? Nurses experience really traumatic events, and there's a lot of improper support and coping mechanisms, which can negatively impact patient care. Some key terms that you may see through this presentation would be well being, resilience, stress, trauma, depression, stigma, and coping mechanisms. So, what are some ways we see mental health struggles in nursing? The first one will be burnout. So, from information gathered in 2023 from the ANA's Pulse on the Nation's Nurses Survey Series, 56% of nurses are experiencing burnout and 64% feel stressed from work, and that's from the American Nurses Association 2023. Emotional struggles, according to the American Nurses Association 2023, two-thirds of nurses are suffering with extremely negative emotions and are not seeking/receiving help. And then stigma, once again, the American Nurses Association 2023 found in their Pulse on the Nation's Nurses Survey series that 56% of nurses feel that there is a negative air surrounding healthcare providers and mental health.
In the article by Chatterjee in 2022, it says that 50% of nurses experience symptoms of anxiety or depression, 38% experience symptoms of PTSD, and 15% have had recent thoughts of suicide or harming themselves. These three stories, we have a few takeaways about mental health struggles in nursing. In the first story, it talks about Michael Odell's suicide and how factors such as lack of faculty support and inability to access medication led to him committing suicide. In the second story, it talks about how it is important for nurses to rely on each other whenever experiencing mental health struggles. And in the third story, it talks about women who are nurses experiencing postpartum mental health struggles and how mental health doesn't only relate to workplace stress, it can also happen because of outside factors.
Now moving into ethical issues, I chose about justice and fair treatment, which going in depth, nurses often face heavier emotional labor, and failing to support these nurses' mental health and well-being implies that their suffering is less important or that it is expected, which shouldn't be, leading to an ethical duty. We're wanting the organizations to ensure that mental health resources are applied to all employees. Then moving into legal issues about risk of malpractice and negligence. Not addressing mental health risk can be viewed as negligence towards the hospital, and errors linked to burnout can lead to malpractice as well. Safety issues kind of leading on top of that or expanding on top of that, talking about increased risk of medical errors. Talking about burnout and mental exhaustion can be recognized as a threat to patient safety, so the lack of mental health support can directly impact the safe nursing practice. And then finally, quality issues, really honing in on this one about reduced quality of care. If nurses' well-being are under addressed mental health issues or are burnt out, it leads to quality care issues, which leads to rush care, decreased patient satisfaction, and lower adherence to the best practices.
Next, we're going to talk about professional responsibilities. Under Texas Board of Nursing Rule 217.11, nurses have a clear responsibility to ensure safe practice. First, we must not practice while impaired in any way that could affect our judgment or patient safety. Second, we are required to accept only those assignments that we are mentally, physically, and professionally prepared to handle. And third, when assigning tasks to others, we must ensure their competence and emotional readiness to provide safe care. These standards protect both patients and the nursing team. Next, as nurses, we have an ethical responsibility to care for ourselves. Provision 5.1 of the ANA Code of Ethics reminds us to safeguard our mental, emotional, and physical health. We must seek support or resources when facing stress, fatigue, or burnout. Taking care of ourselves is essential not just for our own well-being, but to provide safe, ethical care to our patients. Again, self-care is not an option, it's a professional and moral duty.
Nursing mental health strategies and interventions. So for the first one, I picked a more overall strategy, which is prioritizing your health. That prevention is the best intervention. This can include having a good work life balance, incorporating self care practices such as therapy, spa, just anything that helps you feel relaxed, and then also having a good support system, people that you love you, and are going to be there for you when you are having trouble. For the second one, I chose a program ran through the American Nurse Association called Nurse Wellbeing. And basically, this is an initiative that they offer free courses for nurses to obtain education on peer and leadership support and how to improve the work culture in hospitals to support better mental health. For the third one, I chose the program that ran through the Texas Nurse Association, which is called the Texas Peer Assistance Program for Nurses. And this is for nurses who've already gone through a mental health crisis, but helps reintegrate them back into the work field with the support of their peers and giving them different tips and guidelines on how to prevent further crises down the line. For the fourth one, I chose the hospital employee assistant programs because a lot of times these go underutilized and aren't actually known by nurses that are resources that nurses don't realize they actually have access to. And a lot of them provide mental health resources, including free counseling, coaching, and overall just great resources to utilize to improve your mental health and come at little to no cost for nurses.
Next is our call to action. Now that we've talked about mental health and nursing, here are 3 simple actions we can take. First, check in on each other. We're all juggling stress, so noticing signs of burnout or changes in mood can make a real difference. Second, let's normalize talking about mental health. When we're open, supportive, and non-judgmental, it can really help reduce the stigma that keeps so many nurses silent. And third, encourage help seeking, whether it's using resources, counseling, different programs, or just taking a much needed break reminds us that getting support is a strength, not a weakness. Together, we can create a culture where nurses support nurses.
Okay, so for our contributors and our reflection, so I'm Landry. I did the debrief and this little meet the contributor slide. Owen did strategies and interventions to address issues. Madeline did nurses' professional responsibility for addressing the issue and the call to action. Danielle did real world examples and she made the discussion questions. And Sammy did the ethical, legal, and safety issues related to our topic. We all split the required information evenly and communicated to ensure we completed each portion of the project. Everyone was willing to help each other and collaborate to ensure success.
For the discussion questions, the first one is, how does workplace culture, such as expectations of resiliency, understaffing, and other issues, affect how nurses treat mental health? And lastly, how can nurses help change workplace culture in order to protect mental health? And these are our references.